All right. So it said I was going to do this at 7 p.m. I did not specify if I was doing it on Eastern time or Central time. I meant to do it Central time, but I have been doing everyone's sports physicals in the Frisco area. So, and got a little backed up in clinic, but we're going to hit it and start talking about some of these important things. All right. Um, so, welcome back to Driven Healthcare's Pep Talk, everybody. I'm Dr. Carrie Demore. And as always, if you have questions, drop them in the comment section. I can actually see the comments that come through on the podcast. So if you do end up having a question, I'll remind you guys later to go ahead and let me know, and I'll try to answer those to the best of my ability. So if you've been on social media for the last few days, over the last weekend, you have noticed that probably seen headlines, probably seen TikTokers saying things like peptides are legal again. BPC 157 is approved by the FDA. Everything changed this week. But the truth is, none of these headlines are actually correct. So today, I'm going to explain what really happened on July 23rd and 24th, why it's a huge deal, what it means for patients, physicians, and compounding pharmacies, and why this conversation ties directly into something that I've been fighting here locally here in Texas, the big insurance company downcoding crisis. So believe it or not, these two stories are connected. So what actually happened? So let's start with the FDA. This week wasn't an FDA approval. Okay, everybody's talking like the FDA approved these peptides and yay, we can all have all the peptides and they've approved them. But instead, the FDA's Pharmacy Compounding Advisory Committee met for 2 days to review several peptides that have been essentially unavailable through legitimate compounding pharmacies. They've been available on the gray market, people have been using them, but the FDA's official advisory committee actually met and reviewed and said, are we going to be, should these be added to what's called the 503A bulks list? Okay, so that sounds really boring and complicated, but it really matters tremendously in terms of the peptides. So here's why. So normally compounding pharmacies can't simply just make whatever peptide they want. So if a peptide isn't FDA approved, there has to be a legal pathway that allows a pharmacy to compound it for an individual patient. So the 503A bulks list is one of those pathways. So if a peptide makes this list, physicians may be able to prescribe this compounded version through licensed pharmacies under federal compounding rules. Again, this is not FDA approval. This is not proof that these peptides work. It's simply a pathway, a recommendation that licensed pharmacies may be allowed to compound them if the FDA ultimately agrees with them, with the committee. So that's a huge distinction as well. The FDA still has the final say. So, there's huge talk like, so when is this actually going to occur? When will this option be available? So the FDA committee met. Now it goes to the FDA. So this could happen in several ways. It could happen very quickly. They could just agree with the committee's recommendations. They could agree with some of the recommendations and say, we don't agree with all of them. They could also open it up for public comment and have that ability, and then have like a rulemaking period where they review this. So it's not necessarily going to be an overnight thing. So they have to. However, I would say it's speculation, but given the current HHS leadership, with RFK being a huge proponent of the peptides in this administration, being very open-minded to the MAHA movement and alternative therapies, it is quite likely that it may move a little bit faster, and there may be a little bit more pressure. So we'll be watching that. But again, this has been a FDA it's not an FDA approval yet. So when people on TikTok are going, oh, this is FDA approved. No, it's not FDA approved. It's been recommended so that these compounding pharmacies can increase access. And the great part about that, and I'm not a pharmacist, I'm just a doctor, but these compounding pharmacies have a lot of demand for this. And so they'll be able to now do this in a mechanism with physician oversight, which is so important, and take those recommendations specific for these patients and be able to make them in a legal pathway, which is fantastic, as opposed to what's being done now. You're buying it on the gray market. Even people make jokes. It's like you're buying your peptides from the taco lady and the taco truck. But seriously, you don't know where it's coming from. There's always this concern about, are you actually getting a peptide, or am I injecting myself with cocaine? I don't know. So this addition onto the bulks list would be huge for these peptides, and a lot of them are really popular. So I think this is going to be a huge thing. But again, it's not happened fully yet, but we're on that pathway. So we'll go over, which 6 peptides. So there's 6 peptides that ended up being recommended to be put on the bulks list. So, and they're generating the biggest discussion right now. The first one, well, we've talked about it before on the podcast, is BPC 157. And it's probably the most famous peptide in the regenerative medicine space. You hear a lot about it from athletes and things like that, people hoping to use it to improve tendon injuries, ligament healing, muscle recovery, GI, gastrointestinal healing. And all of that excitement comes actually from animal studies in the BPC 157. So human evidence remains limited. That's important to remember, but there is promise. There's promise, right? But there's also not a robust human clinical evidence yet. Then the next one's TB500. It kind of goes hand in hand. It's a synthetic fragment of thymosin beta 4, and it's been investigated for wound healing, soft tissue repair, inflammation, recovery after injury. And again, excellent lab data, limited human data. So many athletes know it as part of the Wolverine stack with BPC 157. However, I think one of the really important things you need to know, especially if you're a high-level athlete, say you're playing in college, you're playing in, sorry, my hair's all messed up. You're playing in college, you're playing professionally, or you're an Olympian. The World Agency on Doping Activity actually has BPC 157 and TB 500 as banned substances. And the FDA versus the WADA are completely separate issues. So the FDA determines whether a compounding or marketing is allowed for medical use in the United States. That's the FDA's job. So the WADA determines whether athletes may use a substance in a sanctioned competition. So high-level athletes should be super aware of this before they try to use it, even though they may become legally available and prescribable by physicians. They may still not be sanctioned for competition. So be very careful with that, and be very careful. Even the testing for it, it's getting better. So definitely if you're in a high level, high competitive market, there will be scrutiny on you. So when this happens, if it goes through the bulks list, say you can get a prescription for it from your doctor, then make sure that you are ensuring that if you're in college or a collegiate athlete, I've got a collegiate athlete in my family, I just make sure that they don't use anything that they may get in trouble for and may be banned from playing. The next one is called KPV, and this is a anti-inflammatory peptide. So researchers have explored it for inflammatory bowel disease, eczema, psoriasis, inflammatory skin disorders, and the hope is targeting the anti-inflammatory effects without systemic immunosuppression. Again, mostly preclinical research. So it's really, we haven't talked about this one on the podcast yet, but we will. We'll get into that in future weeks to talk about it, especially since if it does enter the arena of the 503 bulk list. So The next one is the MOTS-C. So this one is like super fascinating, I think, to me. MOTS-C is a mitochondrial peptide, and researchers are studying whether it may influence metabolism, exercise capacity, and healthy aging, which we all really want a healthy age, right? So this is one of the more exciting metabolic peptides currently under investigation, but human trials still remain limited. So I do have a podcast that we really talked a lot about the adjuncts for weight loss, and MOTS-C was in that podcast. You want to go back and look at that to learn a little bit more. Again, it'll be very exciting if we can have better access to be able to prescribe the specific peptide. The next one is Cmax, and so Cmax originated in Russia. And it has been investigated for cognitive performance, stroke recovery, and attention, and neuroprotection. So outside of the United States, it's actually been studied far more extensively than Americans tend to realize. The peptide was probably the strongest human clinical data we have among the 6 recently recommended peptides, particularly for neuroprotection and stroke recovery. Although nearly all of the evidence comes from Russian clinical research, however, it has never received FDA approval. So Cmax definitely on the horizon, definitely very interesting. No clinical evidence so far that it helps prevent Alzheimer's disease, but there's definitely a lot of research that went on in Russia, in Russian trials and human trials, regarding the recovery from a stroke and post-stroke issues. So keep your eye out on that one. The final one that was approved was actually Epitolon, and I'm probably butchering the name, but Epitolon has become popular in longevity medicine. It's promoted for healthy aging, sleep regulation, and telomere biology. Again, interesting science, very limited high-quality human evidence. So patients should understand the difference between exciting laboratory research and proven clinical outcomes. So just be aware of that. So why is this a big deal? So for years, patients wanting these therapies have found themselves buying products online. Many of those products were labeled for research use only. So nobody really knew, nobody knows where they came from. China, Russia, who knows, how they were manufactured, whether they're sterile, whether they're pure, whether they've even contained what the label claimed is in them. So if these peptides ultimately become legally compoundable, patients could instead receive medications through a licensed compounding pharmacy under physician supervision. And that is potentially much safer than today's gray market, right? So notice I said potentially, because again, none of this changes the need for physicians to evaluate patients appropriately and ensure that they're getting the right care for them. And it doesn't eliminate the need for better clinical trials either. It doesn't mean we can stop looking to see is it safe, what the long-term outcomes are. So, so the next thing is, so let's switch a little bit of gears real quick and talk about something pretty close to my heart, because this isn't only about peptides, it's about access. And right now in Texas specifically, I've been documenting on my X account and been kind of raising a little hell about something extremely concerning. So as of July 1st, 2026, Blue Cross Blue Shield of Texas has begun what they call a systemic down paying or down coding, let's like to call, for higher complexity visits, office visits, for independent physician visits at office bases. So if you go to the office, you come see me in a clinic that I own as a doctor, I'm not part of a insurance-owned clinic, I'm not part of a big mega system hospital independently, they're treating those claims as if it doesn't matter what the diagnosis is. And that's what's pretty concerning. They're down coding those claims. And if you're a doctor and you're independent and you're watching, so what they're doing is they are bypassing your billing system, not down coding, they're not changing the code, they're changing the payment for the code. So the independent doctors are getting like paid very, very minimally. And if you're not paying attention, you may miss this and you may end up a month down the road and be like, where's all my money for the patients I saw? It's because they're not paying it. Several other insurers have done something similar over the last year or so, a little bit differently each one, but this one being the biggest insurer in the state of Texas, having the greatest market share, obviously the most concerning. And this is a little different than the usual ER denial shenanigans, but many physicians believe they are appropriately billing, that they're doing the right things based on their documentation guidelines, but they're being paid at lower levels using wacky adjustment codes, and they're doing it across the board to like all claims. So I had to appeal like nearly 40 claims over the weekend, which is insane to me that I have to appeal. And then I've had a couple of appeals that have come back, and then they've all come back in my favor. But it made me spend my time away from my patients, away from my being able to talk to you about peptides. And instead, I'm having to fight for what should never have been downpaid in the first place and never should have been downcoded in the first place. It's pretty infuriating. The financial impact is absolutely enormous for independent practices. So, and if an independent practice cannot remain financially viable, patients, and many of you that are watching, patients lose access. So if your doctor, if I don't get paid when I'm contracted for with an insurance company, I can't take care of you. I can't keep the lights on. I can't pay my staff. So what happens is these doctors get forced into employment. They get forced into a big system. They get forced into being controlled by a bigger system, private equity, or what have you, instead of being able to make independent decisions for you. So, you'll lose your access to physicians to have time to actually individualize your care. And they lose, patients will lose physicians willing to manage complex metabolic disease. You'll lose physicians willing to prescribe therapies like peptides when they're clinically appropriate. So instead, care becomes increasingly consolidated into large health systems, and less competition almost never benefits you. It almost never benefits the patient. So what you should know, what patients should know, my advice is very simple. Don't believe every headline for peptides, for the insurance, for whatever. Don't believe every influencer you see on TikTok about what's good for you, what's not. Don't assume something is FDA approved because someone on TikTok says it is. Ask questions. Ask whether your physician understands the evidence that's behind these peptides, and ask where your medication is compounded. Ask whether your pharmacy is appropriately licensed. Most importantly, remember that compoundable doesn't mean FDA approved. So those are completely different regulatory concepts. So this week's advisory committee vote could represent one of the biggest shifts that we have seen in the peptide space in years, for sure. But it is still only one step in the FDA process. The agency must decide whether to adopt those recommendations, and that process could take additional time. So meanwhile, the fight for independent medicine continues, and whether it's appropriate access to peptide therapies. So, or standing up against reimbursement practices that threaten independent physician practices. The common theme is this: patients deserve access to physicians who can make individualized medical decisions, not decisions driven solely by bureaucracy or reimbursement algorithms. So before we wrap up, I want to leave you with one final thought. Healthcare policy isn't made in a vacuum. It's shaped by the voices of patients, physicians, pharmacists, researchers, and the elected officials who represent us. If you believe patients should continue to have access to qualified independent physicians, if you believe licensed compounding pharmacies play an important role in patient care, if you believe physicians, not insurance algorithms, patients, physicians, not insurance algorithms, should be able to make individualized treatment decisions. You want the doctor making your choices for you, not the insurance company. Then make sure your voice is heard. Call your Texas state representative, call your Texas state senator, reach out to your members of Congress, tell them that access to healthcare matters, and tell them you value independent physician practices. Tell them you want thoughtful, science-based policies that allow patients and their physicians to discuss all appropriate treatment options, including compounded medication when permitted under law and when clinically appropriate, including peptides. And while you're at it, ask them to take a hard look at insurance practices that make it increasingly difficult for independent physicians to stay in practice so they can take care of you. Because when reimbursement policies force community practices to close, patients lose choice, local access declines, and healthcare becomes increasingly consolidated and expensive. So this conversation is bigger than peptides. It's about protecting the physician-patient relationship. It's about preserving medical innovation while insisting on patient safety and evidence-based care. And it's about making sure that decisions affecting your health are made in the exam room, not solely in an insurance company's claims department. Your voice matters. The future of independent medicine depends on our patients who are willing to speak up. So thank you very much for joining me today and listening to the Driven Healthcare Pep Talk. I hope you enjoyed today's episode. I hope you learned a little bit about what's going on with the peptides and the FDA. I hope you learned a little bit about what we're dealing with on the business aspect and dealing with your insurance company. And please subscribe, leave us a review, share this episode with somebody who cares about the future of healthcare. And before we go, now available, we do have our app available at mypepdocapp.com. And you can access that, and it's $40 a month for total access. You can schedule appointments through there. You can also get information, education, access these podcasts on there, as well as get good dosing. And also as a tracker for weight management, you can track your weight, you can track your blood pressures, see how your cholesterol is trending over time. It gives you some reminders as to what's coming up in terms of screenings that you need for your health so that we can live a long, optimized, happy life. And you can also send me messages if you don't have a physician. The app is also available for physician practices to purchase as well so that they can communicate with their individual patients and utilize the tools that we have there for ensuring hormones, peptides, all the things are managed appropriately and physician overseen. So until next time, I am Dr. Carrie DeMore. Please stay informed, stay engaged, and keep advocating for yourself, your family, and for the future of patient-centered medicine. Have a good night.